Carrollwood Pharmacy and Compounding Center specializes in medical equipment and compound medication. This morning, we are so happy to welcome owner and pharmacist Dan Fucarina to tell us more. Good morning. Welcome.
My pleasure.
So this is very interesting. I've kind of been learning a little bit from you about what it is that you guys do, your team there. Kind of break it down. What is so special about what you guys are able to do that's probably different?
Well, in our pharmacy, we do, like most pharmacies do, conventional prescriptions, antibiotics, blood pressure medications, but we also do custom-made medications. That's what compounded medications are made for. And so, whereas the FDA approves conventional medications, compounded medications are not FDA approved. They are made specifically for a patient for very unusual conditions or to treat very special patients.
Okay. But doctors can still prescribe these?
They can, yeah. There are limitations, and we stay within those limitations. So, for instance, if you have a child that's allergic to a certain filler or a color, alcohol, or a lot of what we do is hormone replacement for women and for men, and so that's customized, made specifically for the patient. All kinds of things, animals, flavoring, human drugs in animal forms.
Which I think is so interesting, because I think people assume they just have to go to the pharmacy that's closest to them or that their insurance takes, but it operates just like any other pharmacy, just with other options that may really benefit your family.
We hope so. Absolutely.
Yeah. So I know you wanted to talk about this morning about a certain kind of eye drop as well. This is a great example of what you guys are able to do there.
Thank you. You know, a lot of people suffer with dry eye. And so here's a crazy option. When I first heard about it, I thought it was just so unique. How about using your own blood to make eye drops? Now, they're called autologous eye drops, and autologous means made from your own body or from your own blood. So you essentially get the blood from the patient. The lab will spin off the plasma. The plasma is a clear part of the blood.
And you're hearing a lot about this now.
Absolutely. They use that for a lot of other processes as well. The nice thing is you're not going to have an allergic reaction to it. Your body made it. We combine it with saline, just salt water essentially. It's all sterilized. It's made in a certain percentage for the patient. And we put it into dropper bottles for the patient to use. It's a great option for patients who have dry eyes.
Well, and that's what I love, is that it's an option. And I think it goes back to, I think people just assume they maybe just have one option as far as their pharmacy goes, whatever is closest. It does you well to maybe look elsewhere.
Absolutely. Most of our patients who get these types of things are not our normal patients. They're patients who come from outside the area or not down the street from us. They might be from other parts of the county or even around the state.
Yeah. Well, thank you so much for coming in this morning and explaining a little bit about your services, what you do. And I hope people, if they have any questions, is it best to come in? Is it best to call? What would you have them do? Yeah,
call and we can tell them the options that are available.
Yep. All right. Well, Dan, thank you so much again. We look forward to having you back.
It's my pleasure. Thank you.
All right. And again, there is the info, the phone number and address as well. But you can also go to our website, too, tbmorningblend.com.